Hello, this is Governor Janet Mills. Maine has been fighting the COVID-19 pandemic for many long and difficult months now. And while people across our state have hunkered down and stayed home when possible to prevent the spread of the virus, direct support workers like you have had to report every day and have reported every day to care for those who need help the most. On behalf of the 1.3 million people of the state of Maine, I want to thank you all for what you do to keep the people you care for as safe and healthy as possible during this very challenging time. Many of the people you support are very susceptible to serious illness and death from COVID-19. You know that. And your work is direct in every sense of the word. It can't be done from a distance. It's up close and hands-on. You're on the front lines of this pandemic. You put yourselves at risk every day to do your jobs out of compassion and commitment to people with disabilities, older Mainers, and others in need of support. So thank you. You've worked extra hours, taken on extra responsibilities, and learned how to use personal protective equipment, PPE, and you have patiently helped residents understand why they could not spend as much time in the community as they would like. The challenges of COVID-19 have felt unending, and patience sometimes wears thin, but your dedication to those you serve and care for is even more dogged. You care, and we thank you for it. Recent news of vaccines is very promising, but we have more difficult months ahead, and in the meantime, your efforts are more important than ever before. Thank you for everything you do to support Maine people, the most vulnerable, their families, and communities all across the state of Maine. Keep the faith and stay safe. We will get through this. Thank you.
Hi, everyone. I'm Nirav Shah, the director of the Maine CDC, and I'd like to echo the thanks that Governor Mills has offered to each and every one of you. I'd also like to take a moment this afternoon to talk a little bit about things that you can do on the front lines to help reduce the spread of COVID-19. But first, let me do something really important. I'd like to take a second to thank you so much for the work that you continue to do every day and have continued to do every day throughout this pandemic. Much of the care that you provide on the front line is not just essential, it's more important than ever. And with some of the things we'll talk about today, I hope to equip you with tools that you can use to prevent the likelihood of COVID-19 transmission occurring in and around all the places that you work. Given where we are right now with this virus and the increasing numbers of cases across the country and across Maine, it is more important than ever to remain vigilant in both your work life as well as your private life. As direct support workers, you face immense challenges and responsibilities, and I have heard numerous examples from my colleagues across DHHS of how you have continually risen to meet these challenges every single day. Now, Maine CDC can't do this work alone, and that means we rely on your continued efforts to work with us so that we can further prevent spread among the staff that you work with and the residents that you serve. I'd like to take a moment today to share some really granular, tactical things that you can continue to do in your professional settings to help keep yourself, your families, your coworkers, and the people that you support as safe as possible during these challenging times. First of all, your agencies have specific COVID-19 policies and procedures that are in place that have been developed with guidance from the Maine CDC. And I ask that you follow these policies and procedures as closely as you can. If you have questions about them, talk to your supervisors or managers to get those questions answered. These policies and procedures should include, at the very least, a few things. One thing is information on the symptoms of COVID-19, so you will know if either you or the people you support need to contact a medical provider. Those symptoms include things like cough, fever, shortness of breath, to name just a few. Those guidance documents should also provide information on what you should do if either you or one of the people you support have been exposed to a person with COVID-19, or if you start showing symptoms of the virus. A really important thing here is that if you work in more than one agency, please inform all of your employers if you have been exposed. All too often in Maine and in other states, individuals have brought COVID with them to multiple facilities. So I ask, if you've been exposed, please let all of your employers know. You should also have information at your agency about how the virus spreads and what you need to do to help prevent this spread in your specific setting. For example, the virus spreads from respiratory droplets, mainly from person to person, between people who have been in close contact with one another, which is about 15 or so cumulative minutes of being within 6 feet of somebody. The biggest risk for spread is being around people who have the virus, even before those people know they have it. And that's why it is so important to stay home if you feel the slightest number of symptoms, and to always wear appropriate face protections, face masks, and eye protection while at work. There should also be information provided to you at your agencies, as well as for the people that you support, about, for example, the importance of washing your hands frequently and staying 6 feet apart while possible. Now, I know that since the beginning of the pandemic, you've heard us talk about 6 feet, staying 6 feet apart. But here's what I want to drive home today. Wearing face coverings, staying 6 feet apart, includes when you are with your fellow staff members on break, in the break room. Unfortunately, here in Maine, we have identified several instances where outbreaks started because healthcare workers and frontline staff let their guard down when they were hanging out with each other in the break room on breaks. So even if you're in the break room, please wear your face covering and maintain as much distance as possible. Please don't let your facility be the next one where an outbreak happens because you let your guard down in the break room. There should also, and finally, be specific guidelines that I ask everyone to follow about the need for things like regular cleaning of high-touch areas within your facilities and in your homes, as well as the importance of how and when to wear PPE, and the importance of screening processes when you enter your work environment. And most importantly, there should be a plan in place so you know where to go and whom to talk to if you or one of the people you support need to be tested. I'd like to take a moment once again to thank you for the work that you do every single day, and offer a reminder about the need for vigilance during this holiday season. If possible, limit the number of people you are physically close to inside of work and outside of work. If you want to learn anything further about any of the things that I've talked about today, further information is available on the DHHA's website under COVID-19 resources. There are videos and guidance documents that are updated regularly at that website as well. Thank you so much, everyone, for everything that you have been doing. I hope you have a wonderful holiday season, and I hope to be able to speak with all of you in person sometime soon.